Hello and welcome. Today we're diving into a common yet often overlooked condition, peroneal nerve injury. This injury can significantly impact mobility and quality of life, so understanding it is crucial. We'll explore everything from its causes to its management. So let's get started. So, what exactly causes a peroneal nerve injury? The most frequent culprit is direct trauma to the nerve, such as a blow to the outer side of the knee or lower leg. This can happen during sports injuries, car accidents, or even falls. Compression of the nerve is another major factor. This can be caused by tight casts or splints, prolonged kneeling or squatting, or even crossing your legs for extended periods. Less commonly, tumors, cysts, or nerve entrapment syndromes can also be responsible. Finally, certain medical conditions like diabetes and peripheral neuropathy can increase your risk of developing a peroneal nerve injury. Now, let's delve into the pathophysiology, or what's happening inside the body when the nerve is injured. The peroneal nerve, a branch of the sciatic nerve, controls muscles that lift the foot and turn it outward. When the nerve is damaged, these muscles can't function properly. The injury disrupts the nerve's ability to transmit electrical signals, leading to muscle weakness, paralysis, and sensory changes. The severity of the injury can range from mild nerve compression, called neuropraxia, to complete nerve severance, called neurotmesis. The extent of damage determines the degree of functional impairment. Understanding the epidemiology, or the distribution and patterns of the injury, helps us identify who's most at risk. Peroneal nerve injury is relatively common, particularly in individuals who participate in high-impact sports or occupations that involve repetitive kneeling or squatting. People with underlying medical conditions like diabetes, which can cause peripheral neuropathy, are also more susceptible. Additionally, patients who undergo lower extremity surgery are at increased risk of developing this injury as a complication. The signs and symptoms of peroneal nerve injury can be quite noticeable. The hallmark symptom is a foot drop, which is the inability to lift the front part of the foot. This can lead to a characteristic step-age gait, where the individual lifts their leg higher than normal to avoid dragging their toes. Numbness or tingling on the top of the foot and the outer side of the lower leg is also common. Some individuals may experience pain, while others may have muscle weakness in the affected leg. The severity of these symptoms can vary depending on the extent of nerve damage. Diagnosing peroneal nerve injury involves a thorough clinical evaluation. The doctor will perform a physical exam to assess muscle strength, reflexes, and sensation in the foot and lower leg. Nerve conduction studies and NCS and electromyography (EMG) are often used to measure the electrical activity of the nerves and muscles. These tests can help determine the location and severity of the nerve damage. Imaging studies, such as MRI or ultrasound, may be used to rule out other potential causes, such as tumors or cysts, that might be compressing the nerve. Peroneal nerve injury can be classified based on the severity of the nerve damage. As we mentioned earlier, neuropraxia is the mildest form, involving temporary nerve compression with no nerve fiber damage. Axonotmesis involves damage to the nerve fibers, but the supporting structures remain intact, allowing for potential regeneration. Neurotmesis is the most severe form, involving complete severance of the nerve, which requires surgical intervention for potential recovery. Identifying the type of nerve injury is crucial for guiding treatment decisions. Treatment and management for peroneal nerve injury vary depending on the severity and cause of the injury. For mild cases, conservative treatment such as rest, ice, and over-the-counter pain relievers may be sufficient. Physical therapy plays a crucial role in regaining strength and range of motion. An ankle-foot orthosis (AFO) brace can help support the foot and improve gait. In more severe cases, surgery may be necessary to decompress the nerve or repair a severed nerve. Following surgery, rehabilitation is essential for maximizing recovery. Pain management strategies, such as medications or nerve blocks, may also be used to control discomfort. Preventing peroneal nerve injury involves minimizing risk factors. Proper footwear and protective gear during sports activities can help prevent trauma to the nerve. Avoiding prolonged kneeling or squatting, and taking breaks to stretch and move around, can prevent nerve compression. If you wear casts or splints, ensure they are not too tight. For individuals with diabetes, maintaining good blood sugar control can help prevent peripheral neuropathy and reduce the risk of nerve injury. The prognosis for peroneal nerve injury varies depending on the severity of the injury. In mild cases, full recovery is often possible with conservative treatment. However, more severe injuries may require surgery and extensive rehabilitation. Even with treatment, some individuals may experience persistent weakness or sensory changes. Recent research focuses on developing new techniques for nerve repair and regeneration, such as nerve grafts and nerve transfers. These advances offer hope for improved outcomes for individuals with severe peroneal nerve injury. Thank you for watching.